Okay, we are going to go ahead and get started. What I would like to ask you guys to do is, as we're going through this PowerPoint and you find questions that are arising, put them in the chat. We're going to leave time at the end so that we can get to your questions. Know that, yes, I am a doctor. I am not your doctor, or I might be, but so I say that because I will answer questions that will allow you to have the knowledge. If it's a specific healthcare need, I will direct you back to your provider. So just know that as you're getting ready to ask questions, let them be something that a provider that is not your doctor can answer for you. So I'm definitely here to empower you in every way. And so if there's anything that I can't answer, I'm open to all questions, and then we'll go through those. So healthcare approach for all body sizes. So I want to introduce who I am just a little bit. And then I'm going to look a little bit into the conventional medicine weight model, like today's weight model. We're going to look at the role of weight in health and how it does need to be addressed at times, and explore new ways to view weight in general, and then look at new ways to approach weight in your health pathway. So I am Dr. Delores Stevens. I am a naturopathic physician, and I have been in the medical field for 28 years. And for 30 plus years, I've been a larger bodied individual. And so I come to this topic with a lot of personal information as well as a lot of medical research that's out there. Since 1997, I've been a respiratory therapist. I worked in the emergency room for 10 years, seeing all different types of people, body shapes and sizes, socioeconomic types, just so many different variables that I saw in there. And I definitely saw that weight was used against patients in that conventional medical model, especially in the emergency room type. Then I also saw it as a massage therapist. What I saw was that the majority of the people that were coming in for body work, which is incredibly healing, they were not larger bodied people and not underweight people. You saw those that fit more into the quote unquote normal range of weight coming in for that self-care. So I saw that outside of the quote norm sizes, people were more hesitant to provide that self-care for themselves. Also, I am a advanced certified grief recovery specialist, and as that specialist, I've really encountered a lot of emotional trauma surrounding weight in a lot of individuals. And so we know that under and overweight, it definitely has an emotional impact. And so we can't leave grief out of the picture, because we definitely see a lot of underlying causes that stem from grief that then result in that physical manifestation. And then I'm also an Ayurvedic counselor, and in Ayurvedic medicine, which if you are not familiar with it, it's the traditional medicine of India. And in Ayurvedic medicine, your weight is never a concern. They don't talk to you about losing weight, gaining weight, none of that. Your body is seen as a perfect vessel that it will adjust to the perfect weight for you as any imbalances need to be healed. And as a naturopathic doctor, I have lots of ways that I can provide you guidance and support in your health journey, in your healing journey. So I don't talk about weight loss. I only talk about weight gain when it is a physical need that we need to sustain life. So I never talk about weight. I never weigh patients unless I have to, and I'll get into that. So that's just a little bit of background on who I am and how I have experience in this topic to be able to talk to you today. Topic one, we're going to talk about the current conventional weight model. And when I say conventional, I typically am embracing the MDs, the DOs, the nurse practitioners, the PAs, all of those professions. They do what they are trained to do, just as naturopathic doctors, acupuncturists, nutritionists, all of those. We can only work within the scope of what we're trained to do. And so in the fields that most of the people are going to in the conventional world, they're seeing doctors that are trained that underweight and obesity are a serious topic that we need to resolve in one way or another. So we're going to look at the dreaded BMI. If you are not familiar with the term BMI, body mass index, it is used nationwide, at least, to quantify how skinny or fat you are. And if you want a little bit deeper understanding, you can see at the bottom of this page.
Quick, Delores.
Yes.
Your screen is not presenting. So if you want to go ahead and share the slides.
Okay. Are you meaning my original?
Meaning that the presentation is not showing up on Zoom for everyone.
Okay.
You got a screen share.
Okay. Can everyone see this now, the dreaded BMI?
Go ahead and hit share screen on the Zoom.
Yeah.
And then choose the window. There you go.
I apologize for that. I teach on Zoom all the time, and I was telling Alan, I was like, I do this all day. But you know, when you get in a setting, you kind of just forget everything you knew. All right, let's get started. Let me back up a little. Can you guys see this now?
Yep.
All right, here we started. The agenda, this is me. You can see some of these are the schools that I went to. Okay, and topic 1. Let's talk about BMI, body mass index. So at the bottom of this slide, you'll see for a deeper dive into the history and the original purpose of BMI and how it's kind of being debunked. Dr. Mary Atwood at Heart of Wellness has a webinar on our archive where she really goes into a deep dive of body mass index, BMI. So BMI has been used historically to grade how skinny or fat you are, like if you're normal or if you're abnormal. And this has been the major underlying source for a lot of emotional upheaval around weight, whether it's under or over, and it causes us to feel this sense of failure around our weight. And if you look at this image on the bottom right, the image of the female who is in that normal range, even the way that they have her posed looks happier than the other poses. She's got a little hip movement. She's smiling. It seems to be a little bit differently. It just looks a little more focused on being happier, which we know is not the case, because most people I know don't fit that image. So if you can look at the grading of BMI of anything less than 18.5 is underweight. And then anything under 20, it's underweight, or they're an endurance athlete, which means that they're expending more calories than they can take in because of that endurance training. And ideal weight is BMI 20 to 22, healthy weight 22 to 25. Like I said, I know very few people that fit into that category. And then anything 25 and above is considered obese of various stages. And I have seen patients that had trauma, emotional trauma, from where they saw on their chart that it said morbidly obese. And this sets the stage for more emotional trauma work needing to be done, and not really a sense of focusing on the issues at hand. So there's also, we see other ways that this is measured. There's an interpretation of higher obesity risk. So they use the waist to hip ratio, and it measures body fat distribution. So you've heard of the apple versus the pear, and how that those lead to different medical risks. So if you're an apple shape, then that has been shown to lead to a higher risk of cardiovascular disease or a higher risk of insulin resistance. Instead of saying, what if insulin resistance is the cause of me having apple shape, instead of maybe apple shape says I have insulin resistance. So we're really seeing some shift in the thinking of, okay, maybe we can look at it in a backwards way, instead of looking at the shape of someone, saying, oh, you're at higher risk of developing something that could be the underlying cause of health conditions that are going on. So I'm not going to go into all of the details of this. Just know that this is used in the conventional medical model to gauge where you are in your body habitus, and it's also used to determine what health risk you're facing and how your health care is going to be driven. So they'll measure waist circumference and hip circumference, and then do the ratio of that. So just know that that is how the apple pear scenario is created. So what exactly is obesity? So according to the CDC, obesity is a common, serious, and costly chronic disease of adults and children. The CDC's overweight and obesity efforts focus on policy and environmental strategies to make healthy eating and active living accessible and affordable for everyone. But on a positive note, the CDC has also realized that there's another side of this, and so they have started promoting an organization called the Obesity Action Coalition, and that coalition has created some guidelines for media portrayals of individuals affected by obesity, such as journalists. And so that when they're interviewing individuals that may fit into this category, they have more training on the language that is appropriate to address those individuals. And so I posted a picture of this guideline. You can download it for free. You can just do a search for that and download that for free. And it's very interesting, educational. And I'm really glad that that is being put out. There's also obesity stigma that is being better understood than it has in the past. And there's more body positivity being publicly recognized about loving your body exactly where you are. And I also know that that is challenging for a lot of people to say, I love my super skinny body, or I love my fat body. And it's really about embracing your body as being a vessel that has carried you through life up to this point, and honoring that and respecting the body that you do have. So that is really how we work at Heart of Wellness, of not looking at, let's help you get to your ideal body weight. And in that conventional model, there are some times and situations when weight loss is not going to be an option. And I bring this up because many times people go to the doctor for something not related to weight, and one of the first treatment suggestions you may hear is, well, you need to lose weight. So there are some situations that will exclude a weight loss conversation. So pregnancy, you typically should not be talked to about weight loss when you're pregnant, because you're wanting to have a higher nutritional intake at that time. Also, if there's unstable mental or medical illness, that's not the time to talk about weight loss, but it could occur still. Some other possible exclusions: cholelithiasis, and that is gallstones, osteoporosis. And keep in mind, these are things that are taught in the conventional medical school arena. So these are times that they are taught not to discuss weight loss, but it doesn't mean that that's not the case, because I've still heard of cases where weight loss is still addressed in situations, especially of osteoporosis. But in osteoporosis, we're really wanting to enhance nutritional intake and not focus on weight. And the reason that they focus on weight a lot of times is the different amount of mass that is being supported by the bones. And so their thought process is, well, if we decrease the mass that the bones are having to support, the bones that are getting weaker can support that. So they're not supposed to, but at the same time, they're looking at it in that way. So that's just an explanation of why they're still asking about weight loss during that situation. A permanent exclusion, so this is never going to be, we're never going to talk to patients about weight loss, is someone with anorexia nervosa or if they're terminally ill. Oops. What exactly is underweight? So underweight, of course, is that if we're looking at BMIs, it's under the range of normal. But if we just look at it as just from common sense point, it is someone that is underweight to the point that they are having difficulty functioning because they are nutritionally deficient in a lot of the nutrient and vitamin minerals that our body needs just to function. But there's a lot less information on underweight than there is on overweight. There's not a lot of research being done on the impact of being underweight. We also see this misperceived as a desired problem to have. We see in the fashion industry that our models many times may be on this underweight side, and it's encouraged. And we've seen a lot of social pushback because we don't want our younger generations to look at these individuals and say, oh, this is what is acceptable and this is what I have to work towards achieving. There's also a lot of misunderstood emotions because while many people are saying, oh, I'd love to be that skinny, the people that's in those bodies that are underweight, they struggle to gain weight and to maintain weight. So there's also a level of emotional trauma. And a lot of times that can be, I'm not enough. I don't weigh enough. I'm not healthy enough. We see that on the obesity side as well. If someone is on the overweight side, they may say, I'm not skinny enough. So we see a lot of parallels on both sides. So it gets a lot less attention, of course, than obesity because, it's not as prevalent in the US, except when we're talking about in the fashion model and in the generations where people are really looking at body image and feeling like there's a lot of body dysmorphia, and we're not going to get into that here. And so that's just helping you see just a little bit about the side of the scale of the underweight individuals. So how does weight play a role in health? Well, if they're underweight, then like I said, there's emotional situations that we see. There's also spiritual and physical. Now, I want you to pay attention to this slide and the next one. And I'm going to go forward. And you can see this is the overweight. They're very, very similar. There's very little difference in the underweight impact and the overweight impact. On the emotional side, not ever feeling enough, feeling too skinny, or not skinny enough. They may feel like their body is betraying them. There's scars from past trauma influencing their body image. And there's also weight discrimination. If you're on the side above that normal BMI, where people consider you to be overweight, you have probably experienced some weight discrimination. I know I have, and it definitely can influence your body image. But underweight individuals experience the same weight discrimination in different ways than overweight, but it still happens. Spiritually, we see that they may feel spiritually unfulfilled. They may need to have more control over aspects of their life and their body. And I've worked with patients in the past that had other conditions that they did not have control of, but they had control of their eating, and that could lead to an eating disorder that would lead to underweight situation. Physical, of course, nutritional, we have vitamin and minerals that our body depends on for processes that happen in the chemistry of our body. And without the correct nutrition, we're not going to have those vitamins and minerals. So we're going to be constantly be deficient in those areas. So what that does, then the body's not able to function optimally without those adequate nutrition. And so what it can lead to is a weakened immune system. It can also lead to hormonal imbalance. It can definitely lead to compromised cardiovascular health, because anytime we don't have the vitamins and minerals that we need, all of our systems are running on a deficient state, and that all leads back to the heart. So our heart is like the pump that keeps us going, and all of our other organs basically feed toward it or away from it. So it's intertwined with every other organ system. So that's kind of the end goal. And if you guys know me, I do a lot of work with cardiovascular patients. So this is something that really impacts my work, getting those nutritional needs met, no matter where your size is. Overweight, we see the same, a lot of the same. Emotional, not ever feeling enough, feeling too fat, not skinny enough. My body's betraying me. Scars from past trauma influencing body image, weight discrimination. So you can see both sides of the spectrum are feeling a lot the same things. Spiritually, a lot the same. May feel unfulfilled, may have a need to fill a void in your life, or suppressing talents or recognition, fear of asking others for help. And this, I think you can see it on both sides as well. Physically, same exact thing. Nutritional deficiency, vitamins and minerals, our body depends on those. Without it, we're not going to function optimally. And so we're going to have, again, weakened immune system, imbalanced hormones, compromised cardiovascular health. That is the end result of all of the other organs having to compensate for not having adequate vitamins and mineral. You may be thinking, how can a person that is a larger body be nutritionally deficient? Well, most of the time when patients come in to see me, they're not coming to see me for a weight-related issue. They're coming to see me for hypertension, so high blood pressure, or AFib, or fatigue, pain, all kinds of things, cholesterol, all kinds of things that you typically go to the doctor for. They're not coming to say, I need you to help me gain weight or lose weight. I'm never going to talk to a patient about gaining weight or losing weight. I'm really looking at where the body needs help. Is it getting the adequate vitamins and minerals? And if it's not, then let's work on that. Now we're going to combine the two of these a little bit, topics 3 and 4, so that we see how you can view your weight and an approach to your health. So weight, is weight really weight? So weight is really just mass, right? Density, amount of space your physical body occupies, right? Well, according to definitions, mass is a fundamental measurement of how much matter an object contains, and weight's the measurement of the gravitational force on an object. So it's gravity's fault that weight is even a topic, right? If we could not think about what gravity does to the body, we wouldn't have weight as a topic. Weight, it may feel heavy, just the word weight, because we think about how much something weighs. Is it heavy? Is it light? And then for underweight individuals, it may have feelings of unmet expectations. I'm not weighing enough. So space, you take up the same amount of space with or without gravity. On the news this morning, I watched where they took this somewhat spaceship, plane-looking spaceship, into the edge of space, and until they went into that space without gravity. Their bodies floated in gravity, and it took up the same amount of space as it would take when they came back into gravity. And so our space is the same with gravity or without. So what if we just called it space? Because your space, the amount of space that your body takes up, is perfect. We don't need to change the amount of space, because that is your space, and you have the right to embrace and love your space. So the way that I approach adjusting the way that people look at weight is first I ask, and this is something that I want you to take and look at, how can I apply this to the provider I'm currently working with? And also we're going to talk about what if that provider is not right for you? What are your rights? So the first thing to ask, how is your overall health? Is it good? Is it okay? Could it use some improvement? Or is it very poor and you need a lot of help? And also, do you feel like you're living life to the fullest? And if you're not, is that due to something health related that you need to get addressed so that you can go back to living life to the fullest? So any pain you're having, any hormonal imbalance, so hormone imbalance would be perimenopause, menopause, postmenopausal. It could be fertility, infertility. It could be thyroid. It could be adrenal glands. There's a lot of issues that we can look at under the umbrella of hormone imbalances. Depression, anxiety, other mental health issues, immune issues. So are you getting colds too quickly? Metabolic issues. This covers a lot. Is your lungs working great? Your heart working great? Your liver, your spleen, digestion, GI issues, urinary tract issues. All of these are issues that need to be the center of your doctor visit, not weight. So what you want to do is you want to seek out a provider that's going to address those issues without addressing any weight issues. So you want to look for a weight neutral provider. And we have those here at Heart of Wellness that can help you. And there's weight neutral providers all over. So if you're not in Olympia and can come to Heart of Wellness, just start looking for a weight neutral provider, because they're not going to take your weight into consideration, with a couple exceptions. There are some medications that we have to dose based on a patient's weight. So for that, we will need your weight just to make sure that we're giving you the right dose. And then there's also some imaging, so like x-rays, CT, MRIs, they also will need a weight because certain parts of the test is based on your mass. And so that's going to be needed. And that's just going to ensure you're properly dosed and that the correct imaging equipment is going to be used for your individual needs, not some standard body size. It's specific for you. You want to commit with your provider to resolving your health concerns one at a time to get proper care. Many times we're looking at focusing on multiple topics at once, and we know multitasking is not effective. It's been proven it is not effective. And when we're doing that on our health, it's not really an option, because if you're focused on a lot of different areas, then you're kind of just getting by on each one of those. So we really look at, let's focus on one area of health and let's get that to the place you want it. And also commit to yourself that you are worth healing any area of your health that is not your optimal view. Everyone has their own optimal view of what they want their health to look like. So we want to help you get to that. What I think of you healthy looks like doesn't matter. What you look at your optimal view of health is the only thing that we want to work on. You want to celebrate with your provider as you heal one area after another and move towards your optimal health point. So if I'm working with you and we're working on your blood pressure, we're going to work on the blood pressure and do all the things that are needed to get your blood pressure normalized so you don't have to be on medication the rest of your life. And then we're going to celebrate that. We're going to celebrate every success landmark that we get that's moving you towards that goal. And you also want to reward yourself. First, you want to create a rewards list. And I've got some examples of what we do. So every time you reach one of your landmarks, you're going to reward yourself with success. Because it is a challenging journey and you need rewards to give you those that momentum to keep doing the things that may be hard, because we didn't get to this place in our health where we needed help overnight. So we're not going to heal it overnight, but we can guide you and support you so that you can heal your body one health concern at a time. And then you want to ask your provider to hold you accountable. And if you've got a good weight neutral provider that is working with you on one situation in one health concern after another, they're going to hold you accountable. And you want to ask them to really hold you accountable, and then they're going to allow you to celebrate from that rewards list. Here's some ideas of rewards list. Go on a tea or coffee date with someone or yourself. Go listen to some live music, get a massage, get some body work, even if it's a facial or acupuncture just for enjoyment. Because you may think, well, acupuncture is a treatment. It is, but it's also can be just a very calming and enjoyable event. Axe throwing. If you got any pent up anger you need to get out, axe throwing is kind of a big thing right now. So go throw a few axe in a controlled environment. Get a mani-pedi. Go to the library or a bookstore. I know we love books. We are a little bit obsessed with books. So our getaway is usually involving a bookstore, maybe a tea date or something. Go on a walk somewhere that really brings you joy, whether it's in the forest, at the ocean, on the beach, wherever it may be, that really brings you joy. But it has to be something that you typically won't do every day. So you've got to set it aside as like, this is a reward, and I'm going to splurge a little bit on myself. So there's a lot of great ideas. I highly recommend that you create a reward list for yourself. So just to summarize, you are not your size or your weight, your skin color, your gender, your sexual orientation, or even your family's DNA. Because we used to think, well, my mom and dad had this, so I'm kind of doomed. That's not really the case. We know lots of ways to help you change your DNA, because we know that cells turn over frequently. We cannot change all of the DNA, but we can modify a lot of the things that have been going on historically through your family to help you prevent the same result happening to you. You are an individual with the ability to bring about miraculous change to your health. And so we are wanting to just support you in doing that. I love the image on the left of all of the females, all the different sizes, colors, shapes, skin pigmentation. I love that embracement. I love the men. You don't need abs to be fab. You know, this is embracing all different body types across the board. So here's a list of the resources that I used throughout the creation of this. And I also want to remind you that we have a lot of these webinars on archive in Heart of Wellness. I start seeing patients on Monday, and I'll be working Monday, Tuesday, and Fridays from 8 to 5. I welcome you to come and work with me or any of the providers in Heart of Wellness. One thing I wanted to be sure that you are aware of is that you have the right to ask for what you need of your provider. I was talking to a lady this morning at the farmer's market, and I was telling her about the webinar, and I told her, I said, I don't even weigh patients unless it's one of those two situations. I'm ordering a medication or an imaging that requires it. She said, I can say no to that. I'm like, you're the boss. This is your health care, and you want to make sure that you are advocating for yourself. You can decline anything. You can ask for anything that you want. This is, I mean, if you think about it, you're paying the doctor. The doctor is working for you. So if the doctor that you're currently working with is not honoring you in this way, look for a provider that will give you that, because without our health, we don't have a whole lot in life, right? You know, we can have all the money in the world, but if we don't have our health, the money means nothing. The fame means nothing if we don't have our health. So putting your focus on health is the optimal goal here. So make sure that the provider you're working with is meeting you in that place. And if not, find someone that is. So I appreciate all of you for showing up today. We at Heart of Wellness have really worked to create this collaborative place for you to come. And one thing I wanted to share too is, if the thing that Heart of Wellness that I love is, we want you to be with the right provider. So if you start coming to me and then I send you to one of our providers for one of the areas they focus on, and you connect with them more, I am 100% okay with you working with them, because we want you to work with the right provider, because then you'll meet all of your goals. So that is all I have for you. And I'm going to stop sharing so that we can address any questions that may be in the chat. Again, thank you all so much. Let's look. Okay, so Stephanie says, can you explain why you wouldn't talk about weight loss during gallstones? Good question. So the gallbladder is really doing a lot of work surrounding fat metabolism. And so like if anyone has had their gallbladder removed or they have gallstones, the body is not really processing fat at that time. So anytime that we start losing weight, that fat metabolism shifts. And so then that process is going to take a little bit different turn. It may cause the gallbladder to start working a little bit harder, and we don't want that. We don't want the gallbladder to do any more work than it is while it's dealing with gallstones. We want to resolve the gallstones, and then if we're looking at addressing reducing the work on the gallbladder with reducing fat intake, that's a different story, because that's about how can we give the gallbladder a vacation, and it may be reducing fat intake. Just like a lot of times I work with patients and I'm like, here's the way we're going to change your eating for 30 days because we need to give your liver a vacation. It's not, I want you to lose weight. Your liver needs a break, or your digestive system needs a little break, or your gallbladder needs a vacation. We need to give our body time to heal. What do you do when you have really bad sugar addiction, which causes you to swell? Such a great question. Sugar, it's like the world's nemesis, right? So sugar is one of the most addictive substance on the planet. And why does it make you swell? Okay. Sugar is seen by the body as a foreign substance. When we're talking about refined sugar, sugar that comes in the form of dates or coconuts or figs, fruit, those don't create that same response. But when we're talking about refined sugars, the body sees it as a foreign substance. And what does the body do to every foreign substance? It reduces inflammation around it, because inflammation is our body's natural way of warding off any foreign substance. So it will embrace it, it will encapsulate it, create inflammation around it. So it's kind of like it's building a dam around it. It's like, you're not getting to the good stuff in the body. We're going to put you in a little dam, and we're going to build a big dam around you. So that all is inflammation. And so what happens then, the body's like, whoa, we're going into inflammation mode. Let's do it everywhere. And so the body doesn't realize it just needs to be in that one area, because sugar goes everywhere. So the inflammation goes everywhere too. So it just becomes like this over-exaggerated state of inflammation. All right, good questions. I appreciate all of those. All right, any more questions before we end today's webinar? The next webinar, while anybody's thinking, the next webinar that we're going to do is looking at embracing all types of people, whether you are on the LGBTQ in that community, if you're in the mental health community, you know, whatever you are, for wherever you're at, we want to look at embracing all personality types and everyone. What are suggested approaches to pre-diabetes and borderline diabetes when a person is morbidly obese? That is, of course, that's tricky. There's a lot of research being done out there. One thing that we recommend to most patients, and funny, I've got it sitting right here just because I use it a lot, the Obesity Code. This is a book by Dr. Jason Fung, and he does talk about the secrets of weight loss in there, but I never use this method with patients for weight loss, but I use it in patients with, and he's also written a book about diabetes, and he uses intermittent fasting, and we intermittent fast every week. There's 2 days a week we don't eat, and it is not about weight loss. It is 100% for specific health desires that we have, that we're working to heal, and we're seeing amazing results with that. And we use intermittent fasting with our patients too. So I would say doing some research on intermittent fasting in patients that are pre-diabetic or borderline diabetic, it really just kind of helps to reset the insulin regulation, the insulin glucose regulating model. And then what do I use to eliminate sugar without crashing? Are you meaning like how to take sugar out of your diet completely? I really like replacing sugar. In the beginning, I started replacing sugar with dates. Dates are very sweet. You can even make your own date sugar. And it's really about just changing your taste buds. You can go cold turkey. You could do it, you know, at a time frame when you're not going to be around people because you might not be too pleasant, but you want to look at ways to replace it. I use pears a lot in because pear juice is really sweet. So you can use pear juice to sweeten. You can use dates to sweeten, and that gets you away from sugar and helps you start breaking that cycle. Yeah, Elaine says, lost weight using oils and still no improvement. Snoring. So snoring can be used due to a lot of different things. It could be inflammation. It could be a structural abnormality that needs addressed. And so I would definitely say if there's snoring related to, that was thought to be related to a weight issue, and then the weight issue was resolved, as you said, and then the problem is still there, you need to go to someone that's going to work with the problem. The problem that you're having is snoring. Well, it wasn't the weight, right? That's what I'm saying. A lot of doctors are like, oh, you're snoring, you need to lose weight. You lose weight, you're still snoring. So we need to look at, why are you snoring? Is it anatomical structure that needs addressed? What is it? Inflammation? So looking at that will, if you get your provider to do that, you're welcome. All right, we're at 46 after the hour. So this is going to be a little bit longer webinar on the archives, but I really appreciate all of you. And stay tuned because we'll be announcing the next one. What do you digest? Suggest a reason why when I do eat, I gain 2 or 3 pounds daily. Oh, I know that's tricky. That's usually about the glucose insulin regulating mechanism. And so you would want your provider to really look at how your glucose and insulin relationship is. So, you know, getting some testing done to see how the glucose and insulin are communicating, and if that is something that needs addressed. And in most people it is, to be honest with you. All right, thank you all. It has been my honor and pleasure to be with you all today, and stay tuned for upcoming webinars and we will talk more. Thank you.